Hi there. Here we are with our patient Chris, who came in for a 7-month follow-up visit. He had a previous hair transplant in California with the FUE method. Can you tell us a little bit about your previous procedure you had in California?
Well, the first one, it was nowhere near as good as this one. I got very little hair just in the front because my hairline receded, so I got 1,000 hairs, and it didn't hold up very well, and shortly after that I needed another procedure.
So how long did it take them to do that FUE procedure on you?
I believe it was 8 hours.
8 hours.
8 hours, and I had to fly to California.
And was it expensive?
Yeah, I had to pay for the hotel, the flight.
So it was very expensive, and you weren't happy with your result.
Correct.
Okay. And so then what made you decide to do a procedure with me?
Well, my brother, for one, he went to Dr. Bolton, and I was pleased with his results, and so I came right in.
Excellent. Okay. And so we did a MaxHarvest hair transplant on you 7 months ago, so your result is not even 100% complete. If you can see his before picture here, you can see it was just relatively thin. And then I'm going to just kind of take you and show you what it looked like from the top there. So you can see he had that thinness throughout the top. Now tuck your head down, please, Chris. So take a look now what this area looks like in comparison to his before. As you'll notice on the before, you can see over here how this was just really thin throughout this whole central density area. So what we were able to do was go through there and fill it in with the multiple follicular grafts to help create density. What I'd like to do is I'd like to show the back of his head where he did the FUE. So when they do the FUE, they're taking tiny little punch holes. Okay, so can you see these little punch holes, Josh? Can you see the little dots? See the little dots? This is a strip. Now this is my strip right above it. This is what I left right here, this little line. Okay? But he's got these little holes all over the place. And so what they do with these little holes is if you were to shave his head, it'd look like a big huge polka dot area. Versus a linear strip across the back, which would, if it really bothered him, could be fixed. You could just graft that line. You can never graft these old polka dot holes. He sees with the camera, or is it you?
Yeah, that's picked up.
Picking up. Mm-hmm. So that's what that looks like all throughout. Is you got the little from the FUE. But if you take a look up top here, you can. This is, as I was saying, this is only at 7 months. It's got nice solid density already coming in. This is going to continue to grow. So if you look at his previous picture back here again, you can see how that's really thin throughout that central area. And now he's at 7 months, and look at this difference already. So big change, big change. Are you happy with what we did for you?
Yes, I'm happy.
Okay, and you still want more though, right?
Still one more.
Would you say you're a junkie?
Yes. It is addicting. I want to come back more. I want to come back one more time and work on my sides.
So you want to see? So you're talking about bringing your temples out a little bit.
Yes.
Okay,
right.
That's a lot of the guys want to do that. Josh had that done as well. But as you can see, I mean, it's not. He doesn't need it. I wouldn't say he needs this. This is total cosmetics to bring that out a little bit. I think he's already come a long way. And once this finishes up, this is going to make a big difference in the next probably 5 months or so. That's going to really fill in. Josh, is there anything you'd like to add?
Well, let's show this last picture from the back angle. And you could see how from the top looking down, that front is very weak. I would also like to ask Chris, every day people respond to the marketing from the FUE doctors where they tell people they could go back to work the next day. They tell them it's a painless procedure. Can you compare the actual procedure for the first week of healing with Dr. Bolton versus what the FUE was like and what the actual procedure was during the day? Is it in fact a painless procedure? Is it easier to go through than a strip procedure? What are your feelings on all that? Is that advertising true?
Yes, the advertising is true, and it's so good that I have a friend in the other room.
Okay, so he's saying was the FUE, the way they advertised the FUE. Did they advertise that fairly by saying the FUE procedure is painless, the FUE procedure is easy to go back to work? Would you say that's so?
I mean,
When you had the FUE?
this is way easier.
Okay, so does that answer your question? Or did you want to... Alright, anything else, Josh?
As I was saying, from marketing, just from my friends seeing my hair, Dr. Bolton did one of my friends today. He's here visiting for a few days, and he leaves tomorrow. He's still in the room finishing up, and he didn't second guess me. He saw my hair and came to Dr. Bolton because of me.
Excellent. Hey man, thanks for doing the video.
No
By the
problem.
way, do we pay you for this video?
Yes, right? What I was getting paid.